Okay, moving right along. Okay, our next presenter and our last presenter, but maybe I guess one of a subject of really some interest is from our performance management team. Today, presenting for the performance management team will be Anthony Jones, who is actually the Manager of Policy and Governance, as our manager is not available. And Anthony will be covering outcome-based management, the system performance management, and I guess linking that into the relevance of the patient activity data policy.
Okay, thank you, Kath. Can I just say that I'm blown away by just how many people have actually made it to the actual, to the last session. It's just fantastic.
Scroll.
Scroll. I just want to actually just say that I look after the information management policy framework, the performance policy framework, and I also used to look after the outcome-based management policy framework. So we're going to give you an understanding of what outcome-based management is, what system performance management is, and how it's related to the PAD policy. If you learn one thing from this session is that with the patient activity policy, without it, it's not just important to those two processes, but without it, those processes wouldn't actually even occur.
Yeah.
So Jess Dean is the manager of system performance. So I do the policy and she operationalises the policy. So she has a team lead, Steph, who does performance management, and Matt, who does the PI development. So what is outcome-based management? People have heard about it, but they don't quite know what it actually is. The government is elected. It has goals and it has objectives. It wants to achieve outcomes. It gives money to the agencies who are then deliver services and programs in the hope of achieving what the government outcomes are. So it's basically the state government holding agencies to account. Now, system performance is separate. That's under the Health Services Act, where the Director General is the system manager, is responsible for monitoring the performance of health service providers and taking remedial action when performance doesn't meet the expected standards. So the first process is the state government holding state government agencies to account. And the second process is the system manager holding HSPs to account. So this is the outcome-based management process. So the government has goals, objectives and outcomes. The state governments make their mission statements and strategic plans to align to those goals and outcomes. And then through the budget setting and resource allocation process, which is called government budget statements, the agency level desired outcomes are established, the agreed funded for the services is established, and the outcome-based KPIs and targets are established. Once that's been approved by the Under-Treasurer, it then goes into the OPM policy. We'll have a look at that in a sec. And then the money is divvied up through the service agreements to the HSPs. The HSPs deliver those services, and then the OPM KPIs are actually reported and measured against the outcomes in the annual report. Now, the Office of the Auditor General audits those KPIs, and then it is the annual report is tabled in Parliament. There are two parliamentary committees that actually hold state government agencies to account. The first one is the budget estimates hearing, and the second one is the annual report hearing. Now, all the CEs, the Director General and the Assistant Director Generals have to rock up to these committees and answer questions that are held accountable to those outcomes the government wants to achieve. So let's just have a quick flick through to the policy. This is the second addendum in the policy. It gives you the outcome or the goal of what the government's trying to achieve, and then how the WA agency, what their goal is, and align to that. And then over here, it gives you the outcome, and then it gives the services, sub-services and programs that will be delivered to achieve that outcome. Go back to the policy again. And then what we have in here is the actual policies. You can actually see down here on the side, the outcomes are actually here, and then the services are here, and then it lists what the KPIs are, and then the actual, what the targets are for each of the HSPs and the Department of Health. If you actually look at those indicators, the vast majority of them are actually their activity, patient activity data related. So without patient activity data, there would probably be very little OBM within the system. So just moving on. So this is system performance management. It is different to the OBM. The health service provider service agreements is done through the Health Services Act. The system performance component of the service agreement is the performance policy framework. And in the actual performance policy framework is the performance management policy. That actually lists the mandated requirements for HSPs. It also includes the intervention processes. It also has the performance monitoring and reporting and evaluation processes. And in the policy, there is also the performance indicators, targets and thresholds. The performance reporting component of the actual policy is the health service performance report. And then that feeds through to the performance review meetings. So we'll just have a quick look at the policy itself. Okay, so that's that graph that I was just looking at. You can actually see the performance reporting component is the health service performance report. All staff within the WA Health system that has a HE number has access to that report. You can just simply log in and it's actually a simple process. We're going to come and have a little look at that in a second. All the performance indicators and targets are in there as addendum. The system performance responsibilities, performance management, and the health service providers' responsibilities are in the policy as well. And then the performance review meetings is a requirement in the policy. And then the interventions are in there. There are 5 interventions within the actual policy. The second intervention requires a performance concern. In the actual policy itself, there is a recovery plan guideline. So if a recovery plan is required, then you can look at the recovery plan. A template is also made available as well. So the actual interventions depends on the performance concern, and it's actually at the system manager's discretion. But there are some pretty significant consequences. So if we go to intervention level 5, the system manager may review the chief health executive of the health service provider. That's a pretty significant thing to occur. And the minister may remove all members of the board. So that's also significant. So you just have a quick look at the actual indicators themselves. You can actually see, if you just go to the top. So the first non-patient activity data indicator is the immunisation. You actually have to go quite far down into the addendum to actually get to the next non-patient activity related data. And that is in here somewhere at the bottom here. It's the Aboriginal employees. So you can actually see over 90% of all the indicators are actually patient activity related data. So without that actual, without that information, we really wouldn't have a lot of actually information to report. So you just have a quick whiz through the, oops, I've got to log in here. So just using your HE number and your password. So the first page it actually sends it through to is just the overview page. It gives all the HSPs. It tells you how many indicators are in scope, and it gives you the performance of those indicators. So who's performing, underperforming, and not performing. Then you can click on any of the actual HSPs and you go to the summary for that particular HSP. So there's actually 2 views in here. The first view is a summary. It just lists all the PIs. The green here says that it's performing, red is underperforming, and yellow is, or not performing is red, and yellow is underperforming. So you can actually see that you can look at it also by comparison. So it actually gives you the indicator with all the HSPs. And then you can actually play around with it. I'm not going to go into too much detail, but if you were interested in, say, just the mental health ones, you could click on that and they'll come up. Or if you're interested in, say, the patient or safety and quality ones, then they'll come up. You can also look at it from the perspective of what is just performing or what's not performing and so on. And then you can also look at those that are just, say, monthly or those that are just quarterly. Now, you then actually click onto the actual individual indicator to have a look for that particular health service. So you get this particular page, which looks over the time series. Now, underneath that is comparison with all the HSPs, and it's also a comparison with all the hospitals that are relevant to it. Now, what you can do, this is a pretty nifty little feature. you can actually click on here and actually compare it to the other HSPs, or you could click on here and compare it to a relevant hospital. Now, underneath here as well is that if I had access, there's record event level data also available. If you have an operational need for it, and if you get the appropriate authorisation, which is actually, the authorisation is Tier 2 for HSPs and Tier 3 for DOH. And then if that is the case and you do get it, then you can contact here. This is the HSPRT. So if you have any questions about those indicators, you can sort of ask them. Now, I just want to actually go back to the policy very quickly as well. If you are interested in how those indicators are developed, there's a system performance indicator information compendium. And in here, it has quite a lot of detail as to the process in terms of identifying, developing, implementing, and all that sort of stuff. I'll just go down to this particular, where is it here? This one here. Concept initiation, the development, the outputs, the governance, and the system performance. What's interesting about this is that this covers the PIs, performance indicators, and system performance, but also the OBM KPIs. A lot of the indicators in both are the same. Sometimes they're different because the under-treasurer approves the OBM KPIs and what might want something different, or the system manager might want something different to what the under-treasurer wants. But in essence, they are actually typically the same. So in conclusion, patient activity data is critical. The application of the business rules, data specifications and definitions provide assurance for the quality and integrity of data. And then the patient activity data supports the efficiency of the data health system and the effectiveness of service delivery. And without it, we wouldn't be able to run an effective WA health system. So any questions? I think we've got a bit of time.
Well, we did. Thank you very much. Went through that nice and quickly. Thank you, Anthony, for stepping in and presenting for the performance management team. And obviously you have quite a bit of experience in that. It was very interesting to learn how high, I guess that high level use of the patient activity data really, informing the accountability of the performance of our health services through to Parliament, Treasury and the Auditor General. And as you said, almost all of it depends on the quality and integrity of the patient data. I know some of you were probably looking at those KPIs that he was flicking through, and you might want to have a look at them. And it's good to know that anyone can log in and have a look at what's going on there. So that's quite interesting. We did have a couple of questions for you.
Mm-hmm. Fire away.
Okay, why are the OBM KPIs not set by the health service providers?
Yes, that's a good question. So there's a legal framework around that. So probably the key reason is that the actual KPIs are actually set by the under-treasurer at the beginning of the government budget statement process. And so the money actually hasn't been given to the HSPs at that stage. It also enables the government to have consistent KPIs across all the entities within the WA health system. So it provides some consistency across that case. But in essence, the Health Services Act also is another reason that it's not possible, because we actually purchase activity from the actual service providers after we find out how much money we're getting from the government. So they're two separate processes.
What happens if a KPI is not met? I think you kind of led to it. Can you give us an example of a situation where, and what was the intervention?
Yeah, so there's a lot of interventions that can occur. I'm not sure how much detail I should be giving, but so it has led to the removal of a CE. It has led to the removal of board members. So the consequences can be quite dire. But it's called a responsive regulation model. So it is a collaborative model. In the performance review meetings, it's really working together to try to address performance concerns as they occur rather than waiting for the end stage. But there is a recovery plan that's required in intervention levels 2. And there have been several recovery plans over the years. So it's an opportunity for the actual HSPs to determine what is the root cause of the performance concern, what are the strategies that will be implemented to address the performance concerns. And then, in essence, the success of the recovery plan is the remediation of the performance concern.
Excellent. There are the performance indicators in the HPR. There are some other ones?
Yeah, so in the actual policy itself, the HSPR indicators are one set of indicators that they look at, but in essence, a performance concern can come from anywhere. There is another dashboard called the SQUIZ, which is the safety and quality. They have a committee which they can bring to the performance review meetings as well. But in essence, performance concerns can come from anywhere. So although we have expected standards of performance and they're listed in the addendum of the policy, performance concerns are something that is dynamic. It can come from anywhere.
Okay. Well, thank you very much, Anthony. That was
Thank
really interesting.